Good afternoon, all. It's my pleasure to introduce the next speaker, Mir Sadat Ali. He is consultant endocrinologist at Haifa Medical Complex, Al Khobar Middle East Hospital, Bahrain, USA. His talk about diabetic foot ulcer management in 2025. Dr. Sadat, the stage is yours.
Thank you very much. Unfortunately, there's a misprint. I am not an endocrinologist, but I always blame the endocrinologist. I'm an orthopedic surgeon and a regenerative medicine. Because whenever a patient comes with a diabetic foot ulcer, orthopedic surgeons always blame the endocrinologist because we say that they did not manage properly. That is the reason why the result has ended up. So let me talk to you. These are my disclosures. There is no financial benefits to disclose from this presentation. Now, my plan today is to give you a little bit of impact of diabetes mellitus. In the morning, we had some data coming from the West and the diabetic foot ulcers. What are the management presently? And what is the recent management in 2025? How we can change the pattern of this disease. Now, Middle East and North Africa, particularly what we call as MENA region, has been, diabetes particularly has been increasing to the limit of 96% by 2045. This is a recent study which came from Saudi, which they suggested that probably by 2045, there will be an increase of 96% in the diabetes. Now, the lifetime risk of diabetic foot ulcers is between 19 to 35%. Recurrence, even if it has healed, goes up to 65%. And the amputations, where is we get involved, orthopedic surgeons, is probably at the end of the line where we had to amputate the limbs. Whatever we do post-amputation, the 5-year mortality is up to 70%. This is the recent data which came from 2023. Now, this is the incidence of diabetic foot ulcers, which is about 40 to 60 million people is affected globally. The national cost for maintaining this in US in 2000s was about 174 billion. Now, this particular slide is in the MENA region. The cost of diabetes care is about $1 billion yearly. And that is too much spending on a disease which can be controlled. If diabetes is controlled early, diabetic foot ulcers will not happen. Now, the number of deaths due to diabetes, and again in the MENA region, we come number 2. It's about 4.8 million yearly, which is before 60 years of age. Now, there's a very complex pathophysiology of the diabetic foot ulcers. Uncontrolled glycemia is the main reason, which causes peripheral neuropathy and arterial disease, and a repeated trauma because the patient cannot feel what the foot is getting injured. Now, who manages diabetic foot ulcers? There is a list of the people, and unfortunately, nobody wants to take a lead. It's a very serious issue. And we come in the end as orthopedic surgeon just to amputate the limbs. And I'm sure the vascular surgeons here also do the same. Now, the standard of control of diabetes foot ulcers is glycemia control, debridement, proper antibiotics, revascularization process, offloading the ulcer by having special shoes. Added to that, because those parameters did not heal the diabetic foot ulcers, the recently added things were advanced wound care products, the negative pressure wound healing. With all that, still, patients are not getting completely cured. Is there any role of stem cell therapy in the treatment of diabetic foot ulcers? Now, when I was working in Imam Abdurrahman Faisal University till I retired last year from there, from 2014, we started using stem cell therapy for various orthopedic conditions. Now, the evolution of the disease management in orthopedics particularly was like this. Earlier, we used to remove the disease part, but now slowly we have come down to where we can regenerate the tissue, and now even we are reproducing the tissue. The skin is being reproduced in the lab, a stem cell lab, where skin can be put in the burns patients. Now, the mesenchymal stem cell, the first time it was discovered in 1970 by Alexander. The name came of mesenchymal stem cell was Arnold Kaplan in US. The first commercial product of stem cells came in 2011. It's already, you can expect 13 years ago, the commercial product came and it's in use. Now, the mesenchymal stem cells are totally unspecialized cells. They can properly, if they are stimulated, they can convert into any type of cells which you want. Like orthopedics, we usually use osteoblasts or chondrocytes for knee or for healing of the bone here. Now, there are plenty of sources. From the embryonic stem cells, we don't use anybody because of the ethical reasons, but we have the bone marrow, the umbilical cord blood, the menstrual blood, and the IP cells. Now, what does these cells have? The first, they have the capacity to divide itself, keep dividing, but they have plenty of factors, right from the VEGF to HGF, cytokines, you name it. In addition to that, what they can do is, even if you inject in the body, like if you inject 5 million, and probably in about 2 to 3 hours, they will become 10 million. So they have this capacity of self-replication, if properly stimulated either in the body or in the lab. Now, I'm surprised a meeting of this nature, I did not find a presentation where people should talk about the conversion of diabetes, type 2 diabetes. The first time it was reported in 2000, I have got two publications which I am quoting down, one in 2011, one in 2022. There are a lot of them where they are reversing type 2 diabetes by single injection of stem cell therapy. Recently, we have heard from China and from Toronto, they have converted type 1 diabetes. So if we can prevent those patients going and suffering from type 1 and 2 diabetes and suffering from diabetic foot ulcers, is much easier to convert initially the disease itself. Now, this is one study which came in 2023. 482 patients were treated with a follow-up of 45 weeks. Bone marrow was given, and there was a complete healing in 71% of the patients, whereas improved size of the ulcer in 29 patients. Now, another study, it was a meta-analysis which came in 24 and 22, 14 studies with 683 participants, where they said the diabetic foot ulcers can be healed much better than the norms which we are using at the present time. Now, how does it do the mechanism? If the cells are going, I don't have a pointer, but once you are injecting in that, they keep replicating, releasing the different angiogenesis factor, suppression of the inflammation, suppression of the infection, and then the healing happens. Now, this is one of the figures which I pictures took out from the publication. You see an ulcer which has been going on for quite some time, but within 3 weeks after the injection of the stem cell, it has healed. Another study where even here you can see the huge ulcer with the tendons exposed, and this is the result after injecting about twice mesenchymal stem cell in the wound. This is another one which is very extensive. After debridement, the ulcer was not healing, and after that, in 3 months' time, the ulcer in the sole healed. Now, conclusions of this, that the mesenchymal stem cells is found to be safe, efficacious, and it can be used routinely in chronic diabetic foot ulcers. Now, the last part of my presentation is a part of this is an investigational new drug in the management of diabetic foot ulcers. Now, this is a new polypeptide which we discovered in Imam Abdurrahman bin Faisal University some time back. It was a polypeptide which was isolated from human placenta. The 3D structure of the peptide is like this. And now, for any investigational new drug in the US FDA, it requires to go through the phases of preclinical studies, the toxicity and pharmacokinetics. Then it can go and apply for human trials. Now, for this particular peptide, 5 different preclinical studies have been done, including in burns, in fracture healing, in diabetic ulcers. This particular study, which I am going to sort of present this today, was published some time back in Experimental Diabetes Research, where diabetes was created in rabbits by giving Elexon intraperitoneally post injection. After 2 weeks, test was done to show that the animals had total diabetes. And then a biopsy was created on a wound was on the ears of the rabbits. And in the control group, only saline was applied, whereas in the study group, they applied this peptide. The method for clinical assessment was histopathology and assessment of the ulcer every time. Now, I did not want to go through the different parameters of the histopathology because it's very extensive. The study is open access journals, which you can look into it and see how it has healed. But I'll just put one particular table where the healing has happened in the study group in 7 out of 10 animals. The vascular area density was statistically significant, 2 or 3 times. Vessel size index, because it's a very powerful angiogenesis factor, it shows that 100% rise in the size of the vessel. So all the way, it suggested that the topical application of this peptide on diabetic wound decreases not only inflammatory cells infiltration, stimulates the new blood vessel proliferation and collagen deposition. Now, after this particular study was completed, an institute, All India Institute of Medical Sciences, which is like a prime institute in India, they tried this polypeptide in the management of chronic non-healing of ulcers. They have this as a phase 1 they did. Their inclusion criteria was ulcers of Wagner grade 1 to 2, and the ulcer which did not heal in 3 months. Size of the ulcer, again, was 2 to 10 centimeters. Any ulcer which was more than 10 centimeters, they did not include. And they also had a criteria of inclusion of the ankle brachial index, which should be at least 0.55, a normal being 0.9. Now, initially, they carried out the standard of care of all the ulcers, whereas for the polypeptide, they applied 25 milligrams twice a day for 3 weeks, and then they recorded the observation. Now, the result was the average age of the patient was about 50 plus. All were male patients. About 76.6% of the patient had type 2 diabetes, which was not controlled. And the mean duration of the ulcer was about 12 weeks. Now, this is where I screenshot the picture from the publication. If you see the ulcer at day 0, the melanin deposition all around gives you the history that the ulcer is not healing for quite some time. Then in about 3 weeks' time, the ulcer was healed. The second picture which they had published, This patient had skin graft as well, but still a portion of the ulcer had not healed, and this took about 2 weeks to heal. This is another picture which they published it. Now, this was another patient who had a plaster sore. He was a diabetic, did not heal, and post application of the peptide it healed. So they concluded that this phase 1 study showed that all patients with chronic non-healing ulcer healed in about 21 days, and they wanted that this study should be carried down further into a phase 2 study, and also they did not notice any adverse events or side effects because of the use of the peptide. Now, what we gather at the search of the literature is that the standard of care of diabetic foot ulcers, we are not going anywhere. So these two studies suggest that the stem cell therapy and this peptide, there is enough evidence that this should be taken forward and to do more studies and to prove that these are really very effective so that it can be established in the routine use. Now, always I used to tell my students that, over the years, that we have been spectators and followers all the time. Whatever the West is saying, we do it. When they say this treatment is good, we follow it. But time has come where we have to develop our own resources, our own way of performing the research and developing new drugs. So what the group which we have in Saudi and here, we are available to support anybody who wish to take this. This is an appeal to the younger generation to take it forward and see that we can develop, discover, and treat our patients. Before I end this, let me thank Dr. Hussain and his team for arranging this fantastic, as usual, the 7th year in running. I hope more years to come. Thank you very much.
Thank you very much, Dr. Sadat, for an excellent presentation.